That feeling, when you see your dog just isn't quite as energetic, maybe sleeping a bit more, it's a worry for all of us as our pets get older.
It really is.
Today we're going to dive into a really serious condition that affects older dogs mostly, but sometimes cats too, hemangiosarcoma.
Yeah, that's the plan.
We're aiming to unpack this complex topic, make it clear and, efficient using our source, Canine and Feline Hemangiosarcoma, giving you the essentials without getting totally bogged down in jargon.
Exactly.
Yeah.
So hemangiosarcoma, basically, it's a highly aggressive cancer. It starts in the cells lining the blood vessels.
Okay.
And it's a huge issue in dogs. Something like up to 70% of splenic tumors found in the spleen turn out to be this.
70%. Wow, that's incredibly high. What makes it so particularly dangerous for pets?
Well, the really critical thing is the risk of rupture. The main tumor can just break open.
Oh.
Yeah, and that leads to sudden, really severe internal bleeding. A dog can seem fine one minute and collapse the next. And honestly, despite everything we try, this bleeding can often be fatal.
That sounds terrifying.
It is. Plus, this cancer tends to, spread quite early. Metastasis happens through the bloodstream, often around the abdomen.
Okay, so who's most at risk here? Is it just random, or are certain animals more likely to get this?
Good question. It's primarily a dog problem. We do see it in cats, but it's much rarer.
Right.
And in dogs, yeah, there are definitely breeds we see it in more often. German Shepherds, Labs, Golden Retrievers are the big ones.
The classic family dogs.
Yeah, exactly. Age is a big factor, too, usually middle-aged to older pets.
Yeah.
And interestingly, there might be a slight tendency for male dogs to be affected more often.
So if you have, say, an older golden retriever, this is definitely on the radar.
Absolutely. Something to be aware of.
So what signs should owners be looking out for? You said it can be sudden, but are there earlier, maybe subtle red flags? Catching it early must be key.
You're right. Early signs can make a difference, but the problem is they're often really vague. That's what makes early diagnosis so tough.
Vague, like how?
Like just weakness or being more tired than usual, lethargy we call it.
Yeah.
Maybe some difficulty breathing or a cough, especially if it's spread or causing fluid buildup.
Okay.
Other things too, like not wanting to eat as much or losing weight without trying, things that can mean a lot of different stuff, unfortunately.
Right, not very specific.
Yeah.
So if an owner brings their dog in with those kinds of worries, what might a vet actually find during the exam that points more towards this?
During the physical exam, yeah, there could be more specific clues. We might see pale gums, pale mucous membranes suggesting anemia from blood loss.
Makes sense.
We might hear an irregular heartbeat, what we call an arrhythmia, or notice the dog's breathing really fast. That's tachypnea. Sometimes the belly feels swollen, distended, maybe from fluid.
Fluid like blood.
Could be, yeah.
Yeah.
Or sometimes the vet can actually feel a mass in the upper abdomen just by, carefully palpating.
Okay, so those are things you might see or feel. Let's get into the why. What's actually driving this cancer? What makes the risk higher in dogs down at the cellular level?
Yeah, this is where the science gets really interesting, especially in dogs. Researchers have found some specific genetic changes.
Like what?
Well, one thing is the overexpression of a protein called STAT3. It's involved in cell growth and survival. They've also found mutations in key tumor suppressor genes. You probably know P53.
Yeah, the guardian of the genome.
That's the one. And another called PTN. These normally act like brakes on cell division, so mutations are bad news.
Right.
Plus, there seems to be an overproduction of factors that actually encourage new blood vessel growth angiogenesis, things like VEGF and angiopoietins. It's like the cancer is building its own supply lines.
Wow, so it's like a perfect storm of genetic changes promoting growth and stopping the breaks.
Pretty much. It's a complex mix driving that uncontrolled growth of blood vessel cells.
And what about cats? You said it's rarer, but do we know anything about the cause in them?
That's the fascinating part, no. Unlike dogs, where we're starting to pin down some genetic culprits, we haven't identified specific causes or risk factors in cats yet.
Really?
Yeah, it strongly suggests the disease might work quite differently between dogs and cats. Definitely an area needing more research.
Okay, so the why is clearer in dogs. Now, how do vets actually diagnose this? It sounds like it could look like other things.
You're absolutely right. It can mimic other conditions. So the first step is thinking about differentials, all the possibilities.
Well, like what else could cause similar signs?
Well, if there's sudden bleeding, you have to consider things like anticoagulant rodenticide poisoning rat bait.
Oh, of course.
And then there are other kinds of masses, both benign and cancerous. In the spleen or liver, things like hematomas, hemangiomas, lymphoma, liver cancer, even cysts,
Yeah.
bleeding disorders too. So yeah, ruling things out is crucial.
So not a simple diagnosis. What tests usually get run first?
Initial blood work is often really helpful. A CBC, complete blood count, might show what we call regenerative anemia.
Meaning the body's trying to make new red blood cells.
Exactly, to replace the lost ones. You might even see immature red cells, called nucleated red blood cells, floating around. Platelets are often low to thrombocytopenia.
Okay.
And interestingly, the shape of the red blood cells themselves can be abnormal. Vets look for specific shapes, like acanthocytes or schistocytes. We might also see high white blood cell counts, particularly neutrophils, and elevated liver enzymes can pop up too.
So a lot of clues potentially in just one blood test.
Definitely.
Any other lab tests that are standard?
Yeah, a coagulation panel is important. It checks how well the blood clots. And this is significant because up to 50% of dogs with hemangiosarcoma develop DIC.
DIC. What's that?
Disseminated intravascular coagulation. It's really serious. Basically, the body's clotting system goes completely haywire. It starts forming tiny clots everywhere,
Oh, wow.
which uses up all the clotting factors. And then paradoxically, the dog becomes prone to severe uncontrollable bleeding. So the panel helps us spot that risk.
That sounds incredibly dangerous. Okay, so beyond blood tests, what about imaging, x-rays, ultrasound?
Imaging is absolutely essential. Abdominal x-rays might show a mass, maybe signs of fluid. And chest x-rays are critical to check for spread to the lungs metastasis.
What does lung metastasis look like on an x-ray?
Often it's like tiny little spots or nodules scattered throughout the lung fields, what we might call a miliary pattern.
Okay. And ultrasound, how does that help?
Abdominal ultrasound is super useful. It gives us a much better look at the spleen and liver, searching for lesions or nodules.
Yeah.
We could also look for nodules on the omentum, the lining inside the abdomen.
And the fluid.
Yes, it's great for detecting free fluid hemoabdomen if it's blood.
Yeah.
And if there's fluid around the heart, pericardial effusion. Ultrasound helps us look for a possible mass in the heart itself, specifically the right atrium, which is another place hemangiosarcoma can show up.
Right. Are there even more advanced scans sometimes, like MRI or CT?
Yes, MRI and CT can be used. They generally offer higher accuracy in telling benign from malignant masses in the liver and spleen. But they're less commonly used as a first step due to cost and availability.
Got it. And staging. You mentioned metastasis. How do vets classify how advanced it is?
Staging helps guide treatment and gives a sense of prognosis. It's usually 3 stages. Stage 1, the tumor is confined, hasn't ruptured.
Okay.
Stage 2, it has ruptured, caused bleeding.
Right.
And stage 3 means it's spread, there's measurable metastasis elsewhere like the lungs or other organs.
That makes sense. Are there less invasive ways to try and get a sample, maybe from that fluid you mentioned?
Yes, if there's fluid in the abdomen, we can do an abdominocentesis, basically tapping the abdomen with a needle to collect some fluid.
What does the fluid usually look like?
With hemangiosarcoma, it's often reddish or bloody serosanguineous or hemorrhagic, and crucially, it usually doesn't clot when you collect it.
Oh, interesting.
Yeah, comparing the red cell count, the PCV, of that fluid to the blood itself helps confirm bleeding into the abdomen. We can also try cytology on the fluid.
Looking at the cells.
Exactly. Or on cells collected with a fine needle aspirate directly from a mass. But, and this is important, the diagnostic yield for hemangiosarcoma from cytology alone is actually quite low, often less than 25%.
Less than 25%, so it often doesn't give a clear answer.
Correct. You frequently need an actual tissue biopsy, usually obtained during surgery, for a definitive diagnosis.
Okay, so cytology isn't a guarantee. When they do get a tissue sample, maybe during surgery, what exactly are pathologists looking for under the microscope?
So grossly, meaning just looking at the tissue, they'll often see these bloody, fragile-looking masses or nodules in the spleen or liver.
Right.
Microscopically, the key is finding these atypical abnormal mesenchymal cells, the connective tissue type cells, that are forming weird irregular spaces filled with blood. You also often see areas of necrosis, dead tissue, and hemorrhage within the tumor itself.
Right.
And because sometimes these cancer cells don't look obviously like blood vessel cells, they use special stains, immunohistochemistry.
To confirm where they came from.
Precisely. They stain for proteins normally found on blood vessel lining cells, like von Willebrand factor or CD31. If those are positive, it confirms it's hemangiosarcoma.
That's a clear picture of the diagnosis process. So now the tough part, treatment. What happens once it's diagnosed?
Well, often the first step is stabilizing the patient if they're in crisis from bleeding. That means IV fluids, maybe colloids, to manage shock and support blood pressure.
And blood transfusions.
Yes, blood transfusions are often critical to replace lost red blood cells and improve oxygen delivery. And if there are clotting problems, like DIC, fresh frozen plasma might be needed to provide clotting factors.
Okay, stabilization first. Then what about the tumor itself?
The main treatment is usually surgery to remove the primary tumor. So splenectomy, removing the spleen if it's involved,
Yeah.
or a liver lobectomy if it's confined to one part of the liver.
Is surgery curative?
That's the hard part. Surgery is crucial, sometimes life-saving in the short term by stopping the bleeding, but on its own, it's generally considered palliative.
Palliative meaning not a cure, just helping.
Exactly. It improves quality of life, extends survival time, but it very rarely cures the cancer because it's usually already spread microscopically by the time of diagnosis. Without chemo afterwards, the average survival time in dogs is, well, it's short, often just 1 to 3 months.
Wow, only 1 to 3 months. That really highlights how aggressive this is. So what comes after surgery to improve those odds?
Chemotherapy. Specifically, protocols using a drug called doxorubicin have consistently shown they can improve remission time and overall survival.
Doxorubicin.
Another approach that's used is metronomic chemotherapy. This involves giving low doses of chemo drugs, often orally, on a continuous, regular schedule. Sometimes it's used alone or sometimes combined with the doxorubicin protocol.
Let's talk about those drugs. Doxorubicin first. How is it given? What are the side effects owners need to know about?
Doxorubicin is given intravenously, usually every 2 to 3 weeks for several cycles. The dose depends on the dog's size, but yeah, there are potential side effects.
Like what?
Gastrointestinal upset vomiting, diarrhea, loss of appetite, bone marrow suppression, meaning lower white blood cell counts, which increases infection risk.
Okay.
There can be heart issues, cardiotoxicity, which can be cumulative, meaning the risk increases with more doses. Kidney problems are rare, but possible. Allergic reactions can happen during infusion, and if the drug leaks out of the vein, it can cause severe tissue damage.
That's a lot to consider. Definitely something owners need to discuss thoroughly with their vet oncologist.
Absolutely. Close monitoring is key.
What about the metronomic chemo? You mentioned low doses daily. What drugs are used there, and what are the risks?
A common protocol uses oral cyclophosphamide, given daily or every other day, often combined with an NSAA, like piroxicam, also given orally.
NSAA, like an anti-inflammatory pain reliever.
Exactly. It might have some anti-cancer effects, too. The side effects are generally less severe than with high-dose 5E chemo. But cyclophosphamide carries a risk of sterile hemorrhagic cystitis. Inflammation and bleeding in the bladder, but not caused by infection. It's irritation from the drug metabolites in the urine. And the NSAs, well, they can cause stomach upset, ulcers, or more rarely, issues with liver or kidneys, especially with long-term use.
So even low-dose chemo needs careful monitoring.
Definitely. Regular checks are important.
It sounds like managing side effects is a huge part of the plan. Are there any newer treatments being researched? Immunotherapy, maybe?
Yes, immunotherapy is a really active area of research for many cancers, including this one. There are a couple things that have shown promise in studies, though they aren't widely available, especially in the U.S. yet.
Like what?
One is a drug called LMTPPE, the long name, liposomal myrimyl tripeptide phosphatidylethylamide. Studies suggested that adding it to chemo might extend survival times in dogs. There's also been research into vaccines designed to help the dog's own immune system target the hemangiosarcoma cells. So, while not standard care right now, these offer some hope for the future.
It's good to know research is ongoing. So after treatment surgery, chemo, what kind of follow-up is needed?
Regular checkups are really important. Usually this means physical exams, blood work to check blood counts and organ function, chest x-rays to watch for lung mets.
Every few months?
Yeah, typically every 2 to 3 months after finishing therapy. And if doxorubicin was used, regular heart ultrasounds, echocardiograms are often recommended to monitor for any heart damage.
And for the metronomic chemo?
With that, routine urinalysis, maybe monthly, is usually added to screen for that sterile hemorrhagic cystitis.
Okay. What about prevention? Is there anything at all owners can do to stop this from happening?
Sadly, no. Based on what we know now, there's no known way to prevent hemangiosarcoma.
That's tough news. And what are the biggest risks or complications, even with treatment? What's the worst-case scenario?
Well, as we mentioned, the biggest immediate risk is acute catastrophic hemorrhage if a tumor ruptures. That can lead to sudden death. Another serious risk is the development of fatal heart rhythm problems, tachyarrhythmias.
Right. So putting it all together, what's the bottom line? What's the overall outlook, the prognosis for a pet diagnosed with this?
Honestly, the prognosis is generally guarded to poor. It's a very aggressive cancer,
Even with treatment.
even with treatment. For dogs, with surgery alone, the median survival time is often cited as somewhere between, say, 19 and 65 days. Just a couple of months, really.
That's incredibly short.
It is. But surgery plus chemotherapy does make a difference. Median survival times typically increase to around 145 to 179 days. So roughly 5 to 6 months on average.
5 to 6 months, better, but still.
Still not nearly as long as we'd want, absolutely. For cats, we have less data, but the mean time to progression is often reported around 4 to 5 months.
It's definitely a sobering diagnosis. So to wrap up our deep dive today, what are the main takeaways for listeners?
I think the key things are, know that hemangiosarcoma is serious and aggressive. Be aware of those potential signs, even the vague ones like lethargy, especially in older at-risk breeds.
Right.
Understand that while the prognosis is tough, treatment options, surgery, and chemo can make a real difference in extending good quality life.
Yeah.
And, importantly, there is ongoing research looking for better therapies, which offer some hope.
Absolutely. And that leads to a final thought for our listeners. Considering how aggressive this cancer is and those genetic links we talked about in dogs, what kind of research do you think holds the most promise? Is it earlier detection, maybe finding ways to prevent it in those predisposed breeds?
That's the million-dollar question, isn't it?
It really makes you think about the challenges and where science needs to go next to help our pets fight this devastating disease. Something to definitely keep exploring.